misuse of opioids in the United States is a problem.
America is now in the midst of a new drug crisis, and it seems that no one is safe from it.
How did this crisis get out of control? Well, a big part of it is that for decades, a lot of doctors were freely prescribing opioids to treat almost any level of pain.
Trevor Noah is right. The Inspector General's office, who's looking into the opioid crisis, says there are as many as 500,000 suspicious opioid prescriptions every year. Concerning figure, considering the Centers for Disease Control says 91 Americans die every single day from opioid overdoses. But Philly, the good news is there are people working to make it better.
Well, thank goodness.
Right? Hey everyone, I'm Patrick Jones.
And I'm Philly.
One name. Welcome everyone to The Vault, a show where we look deep at true financial crime stories. This week, we're looking at opioids. Specifically, Philly, today we're going to be talking about the takedown.
So, is it the Bernie Madoff scandal?
Nope.
The Enron scandal?
No.
The Watergate?
That is a huge takedown, but no. The takedown was a sweep from the Inspector General's office. It was actually the biggest sting on healthcare fraud in our country's history.
Whoa.
Right?
Sounds like a pretty big sting.
They brought down not one big conspiracy, but a bunch of individuals perpetrating different things. Things like doctors charging health insurance companies for services that weren't provided or providing unnecessary services. Like one doctor who was telling people they had cancer when they didn't.
That's so terrible. So, the takedown took down a bunch of individual doctors?
Yep.
And it wasn't just one big arrest?
It wasn't one big crime, it was a series of crimes.
Of health crimes.
Like imagine like a windshield wiper cleaning off the water, except the water.
Medicaid fraud.
Exactly.
Fraud.
412 people went down. 115 of them were doctors, and the crimes essentially defrauded the American people of $1.3 billion. It's really only the tip of the iceberg, too. The Inspector General's office says annually there's as much as $80 billion in healthcare-related fraud in the United States. All right, so the takedown wasn't just about opioids, but I decided to focus our discussion today because of like how awful opioids are.
Totally,
right?
Yep.
And to help me out with like the setup, I spoke with Agent Tyler Smith of the Inspector General's office.
Wow.
Who's like high up. Yeah,
That's big time.
It
Okay.
was great to talk to him to get some contact. Okay, so there were these two guys in Florida who ran a rehab center. Okay, and what these guys were doing, they were charging health insurance companies for things they weren't performing and performing unnecessary tasks. And they were also using these recruiters to get people who were addicted to opioids to come and stay in their center, obviously, because they could make money off that.
Ooh.
Right? And how they were doing that, they were paying those recruiters in things like gift cards and strip club visits.
No.
Yes.
Every good fraud story has a strip club
good
visit.
strip club visit. Actually, it gets even creepier than that. In order to keep people in their center, we're switching and tampering urine samples so that it would always look like people had dirty urine. I mean, urine is dirty. They were mixing in.
Where did they get all the bad urine samples from?
Well, they did have people there who were addicted and were not giving clean samples, and they were mixing them and relabeling
everyone's
them.
samples.
Yeah, so that they would have to stay there.
Oh God.
Right?
Whose job was that in all
I
this?
don't know, and how much
If I was involved in a fraud scandal, I would want the urine switching not to be part of my role.
Hi, I'm Philly. I'd like to be involved with your fraud, but
no urine.
I'm not touching the pee.
Okay, so I don't understand. So what is healthcare fraud, and what does that mean?
I actually asked Agent Tyler Smith about that.
So Medicare and Medicaid fraud, or just healthcare fraud in general, the basic premise is that someone's picking profits over patients. So you have now doctors or others. It doesn't always have to be a doctor. It's not a bad doctor around every tree. And from there, it's the days of where one doctor might actually bill for services that weren't rendered or bill for things that weren't medically necessary are now transforming into organized crime groups who have a system or a conspiracy of several people, both people in the medical practices or others, that result to extra money being put into their pockets illegitimately.
There's a bus in Michigan where several doctors were in cahoots over prescription opioids so that they can start selling those drugs on the street. So what they were doing was they were over-prescribing individuals and using that leftovers to then sell on the street.
A doctor on the street?
Well, I don't know if the actual doctor was just taking off his lab coat and
wearing his lab coat.
Yeah, and go like.
Okay.
But yes, those people were working cahoots with the local drug the local drug dealers I was trying to make it sound like an official thing. It's not.
The drug crime.
The drug crime lords of the area. And as if doctors don't make enough money.
Ooh, God.
Right?
Yeah, that's not good.
Not good at all.
But that seems not as bad as the urine one.
That just because of the urine?
Yeah. That seems like a little bit of an easier way to commit.
Sure. I also have some, like, why is it important to crack down on this type of financial crime?
So for every dollar that's taken from our programs, there's a possibility that that's a dollar that's not making to its intended recipient. We want to make sure that each beneficiary, whether it be your mother, your father, or your children or yourself, get the value of HHS programs. It's one of the more heart-wrenching cases that comes to mind for me, and it comes from a place of having my own mother and my own brother who have cancer, is the fact that one of the doctors who really, I think, had the trust of the patients under his care was providing chemotherapy treatments to people who didn't have cancer, effectively destroying their lives. That's horrific and it's upsetting. And that person was doing that on a couple different ways to be able to only line his pockets with money.
But then that brings us to one of the biggest takedowns. A man that goes...
In the whole takedown.
In the whole takedown.
There's a biggest takedown.
There's a biggest takedown, and I'm going to explain why.
Okay, tell me.
His name, Dr. Diamond.
Oh, boy.
Would you visit a Dr.
That
Diamond?
sounds like a super
Like a Bond villain.
Yeah.
Yeah.
Austin Powers doctor.
Yeah.
Right?
Would you ever go to a Dr. Diamond?
No.
I mean, maybe for a wedding ring.
It does sound like a porn star.
Porn. He was prescribing it to people who didn't even need opioids.
Wait, what do you mean? So
you come to me and you're like, oh, my knee hurts or something. Opioids. So you're like, oh, I got a cough. Opioids. It's like, oh, I'm just alive. Opioids.
And what do we know, right? If a doctor gives you medicine.
Exactly, right?
Okay.
The reason why we go to doctors is because they've been through a lifetime of school.
Right.
And they should be able to, they know what's best for the human body, right?
Yeah. So these people have extra, so they get addicted to opioids, so they have to keep going back to get more opioids from Dr. Diamond.
Exactly, right? And round he goes.
And that's, okay, that's bad.
It's very bad because people got hurt.
Uh-oh.
From 2012 to 2016, the FBI is accusing Dr. Diamond of the overdoses of 7 people. 7 people are allegedly dead.
Who didn't even need opioids in the
Potentially
first place.
didn't even need it.
Jeez. Okay, so I'm an investigator,
Yep.
and I hear about some kind of healthcare-related fraud. How do I go about solving that crime?
Right, it's so interesting because it's like, yeah, what do they follow the numbers? Do they get
Follow
word
the
of
money?
mouth? Exactly. Well, I asked Tyler Smith about that.
We have information that comes from us from many places. Again, with our specialized law enforcement authority, we will use our sources that come to us. We can use our data to be able to find out who's defrauding our programs. But in the end, it's whether or not these cases can be prosecuted through a court that really will prioritize what an agent might take on as a criminal investigation.
So, Philly, now you know about the takedown. What are your
Right.
thoughts?
Well, I'm glad it happened.
Yeah.
I'm surprised I didn't know about it before.
Yeah.
I wonder if now that these 115 doctors have been taken down, if the opioid crisis will get any better. Then again, that's only 115 doctors out of hundreds of thousands of doctors, right? I mean, I might have made that number up, I don't know. But a lot of doctors. So maybe it won't get any better? Or maybe the takedowns really just started and they're going to keep taking more people down.
I agree. I honestly, the main point is that the opioid crisis is a real crisis in this country.
Yes.
A lot of people are passing away.
It is.
And the Inspector General's office did say that they're creating a task force specifically to go after opioid-related crimes. So hopefully there's some light at the end of the tunnel.
Yeah, definitely.
Well, Philly, that closes the vault on the takedown.
Wow.
That was a crazy story, right?
I know. I can't wait
Honestly.
to see what else we can come up with.
That couldn't have been more
You
like,
can come
material
up
than that. Yeah. Well, yeah, if you do like the show, please like, comment, subscribe. If you have an example of a story that you would want to see us work on, I'd love that. That'd be great. I'd love to make this like more of a
Teach me
community.
something.
Yeah. Teach me something.